For more on what's in the Baucus bill, let's turn to a veteran of the insurance industry, Wendell Potter, former communications director at Cigna, now senior fellow on healthcare at the Center for Media and Democracy. Much thanks again for your time tonight, sir.
Thank you very much.
We anticipated the Baucus bill would be bad, it would be difficult to swallow, but a bill that actually makes healthcare more expensive for the middle class and essentially taxes them off the start 13%, and then starts talking about what you're actually paying to see a doctor. How could it possibly be this stunningly awful?
You know, I can't imagine. I read the framework of the bill before this was actually released, and that was bad enough. But to see what it really looks like, I got an email from a medical director who I used to work with who said Karen Ignani must be doing a jiggity jig when she saw this. Karen is the head of the trade group for the health insurance companies. It really is just an absolute gift to the health insurance industry.
Was this bill more or less written by the insurance lobby, or did somebody just anticipate their needs and decide to double them?
You know, that's a good point. It looked at first like it might have been written by the lobbyists and the lawyers for the health insurance industry, but I don't think they would have been quite this audacious to have expected something like this.
If you don't hand over, if you're in that 60,000 plus as a four-member family group, and you don't hand over your 13%, the government could fine you $3,800 under Baucus's plan. You've got no public option to turn to. You have no leverage to negotiate a lower price on any of this. Is this not exactly the opposite of the premise of the choices that President Obama discussed just last week, let alone in the entire build-up to this?
Oh, absolutely the opposite. And the president said during his address at the joint session that he wanted to make sure that no family would have to go bankrupt or lose their homes because of high medical expenses. This would guarantee that more and more of us would be in that boat. It's just absolutely ludicrous to think that this could be something that the president would sign.
Yeah, you could go bankrupt without seeing the doctor.
Yes.
That's enough of the margin at $68,000 of income for a four-member family. You take $13,000 off the top or just the fine. That $3,800 is often make or break for a family with that kind of income in this kind of America.
Right, it is. And another thing to keep in mind, too, is the people who really can't afford those premiums will get subsidies from taxpayers' dollars that will go straight into the insurance companies as well. So they win, 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 and we lose, lose, lose.
Right, to sum it up, lawmakers seem to be looking for a bill that maintains massive profits for the insurance industry, that offers choice but doesn't offer a public option, that creates state exchanges that are not government run, that cost the government nothing while bringing down the deficits and does not negatively impact working families. Anthony Weiner called the possibility of bipartisanship on health care reform like children looking for a unicorn. This bill, this super idea, this is a unicorn, isn't it?
It's a unicorn, but I want to make one more point. The House side and a lot of Democrats are very supportive of the public option. It is not dead. I've talked to many members of Congress this week, including senators, and I think there may be so much outrage and pushback to this bill that it may give the public option a new lease on life.
You almost wonder if there isn't some, and again, Howard Feynman said I was giving them too much credit, if somebody in the Democratic Party wasn't saying, let's put out the worst possible bill, and the recoil from that, the way the pendulum swings back, will get us something decent. I imagine in some work of fiction that might be true. It can't possibly be true here, can it?
I don't know, but this is certainly the worst case scenario, so surely we can come up with something better than this.
Seriously. Wendell Potter, insurance industry whistleblower, former head of PR for Cigna. Once again, great thanks for your insight, sir.
Thank you, Keith.